Okay, good morning, everyone. And today lecture, we will talk about SF-36 questionnaire, its overview, scoring. Here I will discuss about the 4 basic methods of scoring, and then handling of the missing data and incomplete data. If we have any incomplete data or any missing options in the questionnaires for some domain or for some questions, so how can we handle them? Okay, now coming toward the first slide of the questionnaire, which is about the overview. Okay, introduction. Actually, it's a little bit of overview of this questionnaire. The SF-36 is actually widely used questionnaire for assessing health-led quality of life. Okay, it is developed in 1980 as a part of MOS. Okay, medical outcome studies. Actually, it is most comprehensive tool for assessing health, for the health-led quality of life or health assessment, and it is mostly used for the age range from 14 to onwards, from the adolescents to elderly. Okay, but it is not used in the actually in the lower populations, like I mean like the children, or like the children, because for the children we have some other good questionnaire which we call it the pediatric quality of life inventory. We will make a video on that also, like their scoring and their way of handling the data. But in this question we will talk mostly about the SF-36. Okay, now the purpose of this questionnaire is designed to measure patient perceived health status across various domains. Okay, it's captured the physical, mental, and social aspect of well-being. Actually, it is very good because it's cover all the biopsychosocial component. It have the bio component because it has the domain for the vitals and the physical parts, and it has the biopsycho, it has psycho component, and it have the biopsychosocial, it has the social component also. So that's why it's a very comprehensive. So it's cover all the domain that is complete, that is linked to the participant of any individual, any part of their life. So every component is connected and can be assessed by this questionnaire. Now coming toward the third slide, it is about the domains. So it has 8 domains. We already know that the first one is the physical functioning, number 2 is the role physicals, and the third one is body pain, the fourth one is general health, and fifth one is energy and motivation, the sixth one is social functioning, and the seventh is role emotion, and the last one is mental health. Okay, these are the 8 components. You have to keep them in mind. Now this is the questionnaire. So it's actually already available on the PDF form on the Google. So you can download it and see it completely. It's just for your information. I just take a snapshot and take it here. Just you can see it by yourself. Now coming toward the scoring. Steps involved in the scoring, it's actually, you know that each SF-36 domain has a set of questions, and participant response based on the Likert scale. They have, some have the 5 options, some have 4 options, some have 3, and some have 2. You just yes no questions. Okay, so some questions are phrase opposite, so should be score opposite. Okay, what do we mean by this? Because we mean by this, if we come to this domain, what is this? It is actually energy and emotions. And this, when we see this question, like, did you feel tired? So all of the time I feel tired, and the last option is none of the time I feel tired. So when you come here and you think about this question, for this actually in SF-36 question, there is a one basic rule you have to keep them in mind. It is the rule state that the higher value will be given to the option denotes or represent better quality of life. Okay, higher score will be given to the option represent better quality of life. So when you think on these options, so which option represent better quality of life? Did you feel tired? So if the patient says that all of the time I feel tired, it means the patient has less quality, has poor quality of life. Okay, so and none of the time I feel tired, so it means he is energetic and he has good quality of life. So here we can score this as a 1, like none of the time I feel tired. So I laser pointer, so none of the time I feel tired. So sorry, all of the time I feel tired. So it is 1, then 2, then 3, 4, 5, and 6. So none of the time it is the 6 is the better, is the higher value, so it will be given to none of the time. So like this is just like the way normally we do with the Likert scale. This is the normal scoring. Now come to this question. It is a bit tricky. So have you been happy person? Okay, like have you been a happy person? So let's come to the option. So all of the time I am happy, so it's mean it is good, he is energetic and he is good health. But when it comes to the last option, none of the time I'm happy, like I am sad always. So when I am sad always, so it's mean their quality of life is not good. He is not satisfied with his health, he is not satisfied with his present condition. So when it comes to here, we doesn't score it this one, we doesn't score this 6. Okay, because if according to the rule, the higher score will be given to the option represent or denote the better health. So here we give them 6 none of the time. This will be given as a 6, and all of the time will be given as 6, and none of the time will be given 1. Okay, when you transfer it to the raw score, so this will be like this option. If the participant take this, so all of the time, so it is not 1, it is 6. Same is for the other question, like did you feel worn out? So all of the time I am worn out. Okay, or none of the time I am worn out. This is the same like the last question. Okay, so it will be scored if it is. So you can think about it and score it accordingly. The raw score are calculated based on these responses for each domains. Okay, like each questions have different each domain have different questions, so we have to sum the options, collect for each question, and we get the raw score for that domain. The raw score are then normalized to the scale of 0 to 100 for the better interpretation. As we did in the WHO brief, we transfer the raw score into normalized or the 100 scoring system. So the same will be done here. Okay, how can we do it? Will become in the coming slide here. So the first step for this is the first type of scoring method. The steps we discussed, the steps, general steps. Now come to the first type of scoring methods. And the first way is actually sum the score for each question and the specific domain to obtain the raw score for that domain, as I discussed before. Now, how can we do normalization? For the normalizations, we have the formula. The raw score of the specific domain, like for example, the physical function score. Okay, the raw score obtained in the physical function domain minus minimum possible raw score divided by maximum possible raw score minus minimum possible raw score multiplied by 100. So this is the main formula. You have to keep this in mind, and you have to note it whenever you are dealing with the scoring of SF-36 or WHO brief scoring. In the WHO brief, I also put this formula, but most of the students in the comment section, they tell us me that ask for the references of this formula. So now I find the reference. You can take the reference from here. It's mostly present on the page. When you come to this link, you get Word documents. So come to the page 80. On page 80, you will get this formula. So you can cite them if you want to use this questionnaire in your article. So you can cite it from here and keep this formula in mind. Okay, now coming to the scoring steps of the scoring method 1. Okay, the domain score calculation. So actually the normalized score is the domain score for that domain. Okay, when you normalize it to 100, you get, by using this formula, you get the domain score, the final domain score for that specific domain. Okay, this is the first scoring method. When you get the domain score, you can analyze them accordingly. Okay, you can then analyze them according to your research questions. If your research question needs some specific area or type of domain of scoring, so then you have to do this step also. This is the second way of scoring. You can calculate the physical component summary or mental component summary. For example, you give a patient an intervention which specifically involves the physical component. Okay, which specifically address the physical component, like physical type of treatment, which specifically address the physical component, and you want to improvement because of this intervention in the physical component, and also you want to have if there is any placebo effect on the mental component also. So you can do like this. For the physical component summary, you have to sum the physical function, role physical, and the body pain and general health. So you get the physical component summary. And for the mental component summary, you can sum up the score from the vital component, the social component, and the mental health, and the role emotions and the emotional component. When you sum this four, you will get the mental component summary, and you will get the physical component from this summing of this scoring, the domain score from these four components. Okay, so this is actually effective if you want to do a specific intervention and you want to see the intervention effect on the quality of life. Okay, then the 4B, this is another type of scoring depending on your research question, on research objective. If you want to calculate the domain score and compare it with the normal population, or the normal scoring from the MOS, okay, derived by MOS or given by MOS standard. So compare the normalized score of each domain to population norms of the similar age group, or the score derived from MOS. So it's depend on your research question, which type of outcome measure are you expecting, or which type of result are you expecting. So you can either do this, or you can either do this, or you can either do this. Now coming toward the scoring method 3, this is the T-scoring methods. This is also most popularly used. The T-score are actually standard scores with the mean of 50 and the standard deviation of 10. Okay, and this is the formula for the T-scoring system. T is equal to 50, which is actually the mean, and plus x minus m divided by standard deviation, SD. So what is x? X is actually for the raw score for the specific domain. M is actually the mean of the domain, and the standard deviation of the domain of the component scoring. Okay, now interpretation, the T-score of 50 is taken as average. Score above 50 indicate above average performance, and score below 50 indicate low average performance, okay, compared to the reference population. Now coming to scoring number 4, this is called the Z scoring methods. The Z scoring are actually the standard score with a mean. Here the mean is 0 and the standard deviation is 1. Here the formula is Z is equal to x minus m divided by standard deviation. It's the same here. X represent the raw score and m represent the mean of the domain score, and the standard deviation is the same. Here the Z score is 0. The 0 is average. If the patient has a positive value, mean above 0, so it means they have above average quality of life. And if they have negative value or below 0, it means they indicate below the mean below average quality of life. Now this is the general interpretation. As I talked earlier, the higher score indicate better health. Now let's take an example. As everything we discussed, now let's apply it on one domain, because it is a very big question, so I can't take each domain. So for your understanding, I will take only the limit of activity domain. Okay, because in the previous video most of the students asked that my physical component is this, please calculate the scoring for me. For this I keep an example in this video. A limitation of activity domain actually does your health. This is actually 10 scoring in this domain. Limit of activity domain have 10 questions, and all of these are the 10 questions. Let's take the patient's name is Khushi. Khushi is our patient who actually did this this domain, and his score is, for this question he has 2, and for this she has 3, then 1, then 3, then 2, then so on. So let's come to the next slide. Calculating the raw score for Khushi. So calculating the raw score is actually summing up all the score that she answered. Here 2, here 3, here 1, here so, and 2 on. So we sum up 2, 3, 1, 3, 2, and so on. We get the raw score of 23. Now when we get the raw score, let's calculate it normalized scoring. Normalize the raw score, normalization of the raw score, which is our second step. Okay. This is the second step. So before that, we have to understand what is the maximum possible value. The maximum possible value is actually our, and for example, in that domain, if we have 3 options, so the first option will be given mark 1, the second option will be given mark 2, and the third option will be given mark 3. So when we have 3 is the highest value for each question. So when we have 10 questions, so 10 multiplied by 3 is actually 30, which is the highest possible score. And each question has 1 is the lowest value. So 1 multiplied by 10 is equal to 10. So 10 is the lowest possible value, and 30 is the highest possible value for this physical limitation domain. Okay, so now normalize it. The formula, as I discussed earlier, so the raw score, which is 23, This is 23 minus minimum possible raw score, which is 10, as I talked earlier, and the maximum possible raw score, which is again 30 here, and minus 10 minimum possible raw score. Okay, multiply by 100. Okay, when we multiply by 100, we get 76. So it is 76, it is above 50, so it means above average quality of life for the Hushi. So this is again score above 50, above average health quality of life in our case. So the final for A and for B can be done, mentioned previous slides, by the calculating PS physical component summary and mental component summary, and then make a comparison with the healthy. Depend on, as I talked earlier, depend on our outcome, depend on our research questions, and depending on our objective, what thing we expect from this questionnaire, so we can do it accordingly. I gave you all 4 possible options what to do. Okay, you have these 4 options when you are dealing with SF-36, so you can deal it accordingly. Now, magnitude of difference, this is the most important slide. Okay, for example, if you give if you measure the health quality of life using SF-36, then give an intervention. Okay, and then after some time, 1 month or 2 months, you again reassess the quality of life, and there is a changes in the score when you compare with the baseline, the before intervention. So how can we take this? These changes is clinically significant, clinically meaningful or not. So here we get the cutoff. Difference of 5 point or more are typically considered as a clinically meaningful. For example, if Hushi scoring is here 76, but after doing some intervention or some treatment, he get 82. So it is more than 5. So it means the intervention has clinically meaningful effect on health quality of life. Okay, not. And both PSC and mental component summary, higher score represent better health quality. So it is the basic rule. Higher score, is always better quality of life. Now coming toward the handling missing data, just most of the time we always, because it's a very big question, so sometimes the participant doesn't answer for some question because of different reason, lack of time, or because of the randomly they doesn't answer any question. So let's talk about first which type of data we can face when we are dealing with, which type of missing data we are facing when we are dealing with SF-36. So type of missing data, missing completely at a random. This is first type of data. The scenario is like the patient participant forget to answer certain SF-36 question, okay, without any pattern. Okay, where he didn't answer first question, then he didn't answer 20th question. Okay, there is no pattern and missing, just he forget to answer because there's too many question, and they are the questionnaire is very like congested, so sometimes they skip one question. So how can we deal? Handling strategy is like imputation methods like mean and median imputation or multiple imputation. These are coming in the coming slides. Now missing at a random, data missing based on other observed variables. Okay, for example, participants with a lower physical health score are less likely to answer certain SF-36 questions. Okay, if their health problem is very poor, so they can't answer certain questions. For example, if he can walk with the crutches or he can walk with the cane, so there are some questions that are specifically involved or linked with the independent walking, so he cannot answer because of his illness. He didn't want to skip, but he skip it because it is not relevant to his current health. So how can we handle this? We can handle it like imputation methods, like multiple imputation, and considering other variables. Now the third type of missing data is data missing due to unobserved variable or factor not included in the studies. For example, if the participant is like is bedridden, for example, he is non-ambulatory, and the physical component score, most of these scores cannot be answered by him because he is not non-ambulatory patients, he is bedridden. So these these questions can be answered by participant, so we can handle it by it is actually challenging to handle, but technique like pattern mixture methods or sensitive analysis can be considered. Okay, now in improper selection, for example, sometimes the participant answer 2 or more than 2. So how can we handle this type of situation. If two adjacent responses are selected, okay, for example, first and second are selected, like if the participant answered two options for one questions. So for in this scenario, we will take randomly one, okay, whether first or second, we can take randomly anyone, okay, it's okay, according it is the questionnaire guideline. The second is if the two adjacent are selected, if two non-adjacent are selected. For example, first for question number one, they select one option number one and option number four. So in this case, there is no pattern, okay. So in this case, this can be dealt as a missing data, okay. How the way we deal with the missing data. So this question is also deal with the missing data. No option will be selected. If more than two are selected, if the person answered three for one questions, okay, three options are selected, and the same here, they will be taken as a missing data. If instead of yes no question, there is some in the pen domain, we have the yes no questions. So if instead of selecting yes or no, he just write in front of the question yes, or he just write no, so it will be selected as the participant right, okay. It has no issue with the scoring, so it is according to the guideline. You can also, if you want to take a reference of this, it is also the same reference that I cite from the formula, okay. Now way of handling, likewise deletions, okay. Scenario and the study with 100 participants, that if the 10% didn't answer certain SF-36 questions, so exclude these 10 participants from the analysis, okay. This is the like easy way. If you are looking for the easy way, okay, like shortcuts, so this is the shortcuts, okay. You delete it just simply. If there is a missing questions and some responses, so just delete it. But it has an advantage, it is simple, no assumption about missing data mechanical, because you don't have to write it and you don't have to justify what I did with the missing data, because whenever you whatever you do in the research, you have to mention it in your writing and give some references why how I do and why I do, okay. So if you don't want to answer why and how, so you have to just delete it. But there is a disadvantage always. When there is a shortcut, there is always disadvantage, okay. So it actually reduces the sample size. If your sample is too large, so it is not a big deal. But if your sample is already too small and you do like list-wise deletion, so there is a problem for you to lack generalizability of the study if you lost too much sample size. The second one is mean median imputation. It is actually like a good methods. The participant doesn't answer one SF-36 question related to the physical functioning. For example, this is a scenario. So replace the missing value with the mean and median of observed value for that variable. For example, 10 participants, out of 10 participants, one didn't answer. So you have to take mean and median of the 9 participants and take the median value for that missing question of that for that questions, okay. Now advantages is the sample and return sample size. Disadvantages, alter the distribution, may underestimate variability. This is the problem with this method, okay. Because missing data is a problem, we are actually making a ways to deal with it. But there is also in every way there is a problem in every way, because whenever you do a mistake once time, the 1,000 times you try to correct it, but there is still some problems, okay. So the multiple imputation, this is the fourth methods. Scenario, several SF-36 has been missed, okay. Several if there this is for one SF-36 question missing, but here if you have several missing options, okay, then generate multiple data set with the imputed value, analyze each separately, then pool result. Actually, I explained this method in detail in the sleep quality index questionnaire. It is mentioned in the description. That I will put the link in the description. If you want to learn more about this method, you can come to that video. I explain it in detail about it. The advantage is actually it retains sample size, preserve variability, okay, account for uncertainties. The disadvantages, assume data is MCR or MAR, okay. MCR is a type of error, a type of missing data that I discussed in the previous slides. Now considerations. Whenever you are dealing with a missing data, clearly document the chosen handling strategies, rationale, why you choose these methods, and any assumption made. Okay, justification, provide justification for the selected method based on the nature of missing data and study design. Okay, you have to be you have to be what we call it, to be sincere whenever you are writing or you are doing research. And this is our last slide. Thank you so much for your time, and I